Tonight, Georgia now has the fifth highest number of cases of monkeypox in the country at 158. We're actually third among states when you look at it by population. Fulton County is seeing the majority of these cases.
And so now they are partnering with Atlanta Pride to try to get that information out to as many people as possible. Some of the work these groups are already doing and is trying to get accurate information out to people.
And some people could be mistaking lesions as a pimple or a cut. It's that minor. 11 Alive's Hope Ford spoke to someone who has monkeypox and says those lesions can start small and then spread pretty quickly.
A small lesion on Antonius Minifield's hand sent him to the doctor. He was tested for syphilis, which came back negative, but a few days later,
I just went into the restroom and turned on the lights, and all of a sudden I just saw marks, just marks everywhere.
It took an ER trip and a 16-hour wait before he found out.
One person, once they saw my rashes, they were like, "Oh, this is like a monkeypox."
In Arkansas, it took Minifield 4 days to get his official test results back. By then, his symptoms were worse.
It itched. It itched. Oh my God, it itches. It itches. It hurts to the touch.
Minifield shared his experience during a town hall put on by Atlanta Pride and the Fulton County Health Department. Currently, Fulton County has the most cases of monkeypox in Georgia.
As of the 21st, we're at 106 cases of monkeypox.
And the county is having trouble getting and distributing limited vaccines.
We had 300 vaccine slots, and in 4 minutes, all 300 of those closed down.
Those are just some of the problems Fulton County and the state is dealing with. There's issues with contact tracing and getting accurate data. On top of that, people with monkeypox and those exposed are asked to quarantine for 3 to 4 weeks.
We have to provide government subsidies to allow people to stay home and isolate and not go to work, and ensure that people don't lose their jobs because they are home with an illness.
Georgia Equality is asking for more vaccines and trying to get the state to use some of the COVID funds to increase outreach, which they say is pivotal to slowing down the outbreak.
And again, addressing the stigma, this is not a disease that only affects people of color. It's not a sexually transmitted disease. It's a highly transmissible virus that comes from prolonged skin-to-skin contact with lesions.